So for today's procedure, I will be performing bed bath, shampooing, oral care, and back massage. But before that, I will be reviewing the patient's chart to check if there are any movement limitations. After checking, I will be bringing the equipments to the bedside table for easier access. And after that, I will be performing hand hygiene. After performing hand hygiene, I will be putting on my gloves. After putting my gloves, I will be identifying the patient and explaining the procedure. Good day, sir. I am Danny Lu, and I am your student nurse for today from Our Lady of Fatima University. For verification, kindly state your name and your birthday.
Please, Alexander Steele, February 27, 2007.
So for today's procedure, I'll be helping you to bed bath, shampoo, and oral care, and also back massage. If that's okay with you, can I please have your consent?
Yes.
After that, I will be closing the curtains for privacy, and I will be lowering the bed and lowering the side rails for easier access. After that, I will be removing the top cover and then placing a bath towel above. After that, I will be asking the patient to hold the bath towel while I remove the linen under it. Sir, kindly please hold the bath towel.
Sure.
After removing the linen under the bath towel, I will be proceeding to the bed bath. I already put warm water to the basin, and I also have a soap for cleaning and for using during the bed bath. Now I will be folding the washcloth without soap. I will first clean the eyes of the patient, starting from the inner to the outer. After cleaning the patient's eyes, I will be moving on to the face, neck, and then the ears. Before cleaning the face, neck, and the ears of the patient, I will be putting a towel on the patient's chest. Now I'll be moving on to cleaning the face, neck, and the ears of the patient. After cleaning the patient's face, neck, and ears, I'll be moving on to the arm, and I'll be putting the towel under the patient's arm. I will be cleaning the patient's arm, starting off to the hand up to the axilla. After that, I will be cleaning the in-between of the fingers. And then, repeat the procedure to the other arm. After that, I will be placing the towel on the patient's chest. And then I will be lowering the wash towel up to the umbilical area for me to clean the chest part of the patient. After cleaning the arms of the patient, I will be moving on to the chest and the abdomen part of the patient. After cleaning the chest and the abdomen part of the patient, I will be moving on to the legs and the foot of the patient. Before that, I will be returning the wash towel to its original place and placing the towel underneath the patient's legs. And then I will be moving the wash towel up to the perineal area of the patient. After placing the towel underneath the patient's legs, I will be now cleaning the patient's leg from the ankle to the knee and up to the groin. Repeat the procedure to the other leg. And then after cleaning the legs, I will be making sure to clean the in-betweens of the toes of the patient. After that, I will be returning the wash towel to the original place. Now, I will be helping the patient to turn to a prone position for me to clean his back and his buttocks area. Sir, kindly please turn to your left. Now, kindly please lay down on your chest. After the patient turned to a prone position, now I will be exposing his back to clean it. Before cleaning his back, I will first change my water on the basin and my washcloth. And then I will now start cleaning his back. After cleaning his back, I will now move on to his buttocks area. After cleaning the patient's back area, I will now perform back rub. After performing a back rub, I will return the patient to his comfortable position and then help him to wear his clothes, and I will be putting his linen, and then sir, kindly please turn to your left. Now kindly please lay on your back. After the patient wear his clothes, I will be putting the linen back. After doing the bed bath, I will be now shampooing the hair of the patient. But first, I will assume that I lowered the bed and I position the client. After that, I will be filling up the basin with warm water, and then I'll be assuming that this is a drain container. After that, I will be putting on now my gloves. After putting on gloves, I will be putting a dry washcloth on the patient's forehead. Now, I will be starting the, after I start the shampooing, I will place a pad underneath the patient's head. After placing the pad, I can now start shampooing the patient's hair. First, I will be pouring water on the patient's hair. After pouring water on the patient's hair, I can now apply shampoo and then massage the hair of the patient. After shampooing the patient's hair, I can now rinse it off with warm water. After rinsing the patient's hair, I can now remove the washcloth on the patient's forehead. I will now provide a towel for the patient's hair and pat it dry. After patting the patient's hair dry, I can now comb the hair. After gently combing the patient's hair, I can now remove all the equipment, remove the pad under the patient's head, and then return the patient's body to the comfortable position. After that, I will now remove my gloves and perform hand hygiene. After shampooing the patient, I can now proceed to oral care. I will be providing a wash towel and placing it on the chest of the patient. After that, I will be assisting the patient to do oral care. Sir, kindly please open your mouth. After cleaning the patient's teeth, I will be providing a glass of water for him to rinse his mouth. After that, I will be providing a washcloth to clean the edges of the mouth. After that, I can now remove the wash towel and remove all equipment. Position the client comfortably. And now I can remove my gloves. After providing oral care to the patient, I will do the last step, which is back massage. Before doing the procedure, I will be offering back massage to the patient and explaining it. Good day, sir. So for today's procedure, I will be performing a back massage. Is that okay with you?
Yes.
Okay. Do you experience any pain right now?
No.
Okay. So after assessing the patient, I will be assuming that I will be raising the bed, and I will assist the patient to a prone position. Sir, kindly please look, turn to your left. And I'll take the chest. After positioning the patient, I can now expose his back. Sir, I'll be exposing your back. Is that okay with you?
Yes.
After exposing the patient's back, I can now warm the lotion on the palm of my hand. And now I will be starting the back massage using 4 massage techniques. First, I will be doing the stroking technique. After the stroking technique, I'll be moving on to the friction. Moving on to the next technique. And now to the last technique, which is the kneading. After performing the massage techniques, I will now return the patient's clothes, and I'll be helping him to a comfortable position. Sir, kindly please turn to your left. And now, lay in your back. After performing the back massage, I can now perform hand hygiene and continue documenting if there are any abnormal findings during the procedure.